Hello everyone, I'm Orna Reges. I'm a cardiovascular epidemiologist from Ariel University and Clalit Health Services in Israel. Today I will be talking about trends in the incidence of cardiovascular diagnosis and procedures over the years 2012 and 2021 in Israel and the impact of the COVID-19 pandemic. The study was published in the Journal of Clinical Medicine in 2024. And before we begin, I would like to thank my colleagues at Clalit Health Services for their collaboration and contribution. All authors declare they have no conflict of interest. With the outbreak of COVID-19, the first step for most health systems was accelerating the use of telemedicine and reducing unnecessary in-person visits. This was also the case in Israel. Previous studies mostly reported declines in diagnosis and procedures during the initial phase of the pandemic, while different trends were observed as the pandemic proceeded. Those studies, however, mostly reported a limited number of outcomes or compared the COVID-19 period to a short period without considering pre-pandemic trends. From an epidemiological point of view, it is more accurate to evaluate the consequences of the pandemic while taking into account the expected incidence of CVD outcomes based on pre-pandemic trends. Therefore, the objectives of this study were first to describe trends in the incidence of cardiovascular diagnosis and procedures over the years 2012 to 2021 in Israel, and two, to compare the first 2 years of the COVID-19 period with the preceding 8 years. This was a retrospective population-based observational study. We included individuals aged 25 and older who were insured by Clalit Health Services, the largest HMO in Israel, and to distinguish between the pandemic and the pre-pandemic periods, we defined each study year as March through February of the following year. We calculated annual incidence rates for cardiovascular diagnosis and procedures over the entire decade. The COVID-19 period was divided into 2 years, year 1 from March 2020 to February 2021, and year 2 from March 2021 to February 2022. The pre-pandemic period covered the 8 years before COVID from March 2012 to February 2020. Cardiovascular diagnosis and procedures were defined based on the ICD-9 codes documented in the hospital or the community clinical records. Cardiovascular diagnosis included incidence of STEMI, non-STEMI, atrial fibrillation, congestive heart failure, and CVA. Procedures included ablation, catheterization, CABG, pacemaker, and defibrillator insertion. We calculated annual incidence rates for each cardiovascular outcome from 2012 to 2021. To assess trends before the pandemic, we used the Cochrane-Armitage test. Then we compared the incidence during the pandemic to both the last pre-pandemic year, 2019, and to the trend from the prior 8 years. For comparison to 2019, we calculated risk differences, and to check whether COVID period data deviated from expected trends, we fitted a linear regression line to the 2012 to 2019 data and compared predicted versus observed values for 2020 and 2021. A deviation was considered meaningful if the observed 95% confidence interval didn't include the predicted value. Between 2012 and 2021, the study included an average of 2.6 million Clalit members aged 25 and older each year. As shown in the table, sex and age remained stable over time, which is important because it means the trends we observed are not likely due to changes in the composition of the population. During the 8 years before the COVID-19 outbreak, we observed a significant decline in the incidence of several cardiovascular diagnoses, particularly STEMI, CHF, and CVA. Atrial fibrillation showed only a modest decrease over time, and unlike the other diagnoses, non-STEMI showed a clear increase in incidence over the pre-pandemic period. Among procedures, there was a significant decline in CABG and defibrillator insertion, while the rates of catheterization, ablation, and pacemaker insertion remained relatively stable. When we compared the first year of the pandemic to the year just before COVID-19, we saw a significant decline in all major cardiovascular diagnoses. STEMI and non-STEMI both dropped by over 16%, atrial fibrillation by 14%, CHF by nearly 8%, and CVA by 5%. In the first year of the pandemic, we also observed significant declines in all cardiovascular procedures. The largest drop was in CABG with a decrease of nearly 78%. Catheterizations declines by almost 65%. Pacemaker implementation by 39%. Ablations by 21%. And defibrillator insertion by about 30%. What happened in the second year of the pandemic? So in the second year, all cardiovascular diagnoses and procedures increased compared to the first year. However, when we compare these rates to the pre-pandemic baseline defined as the year 2018, the picture is more nuanced, meaning that STEMI, non-STEMI, and atrial fibrillation rates remained lower than in 2019, but the declines were smaller than those seen in year 1. And CHF and stroke rates nearly returned to the 2019 levels. For procedures, CABG was still lower than in 2019, while catheterization rates had fully recovered, and ablation, pacemaker, and defibrillator insertion rates increased significantly, going beyond 2019 levels. As I mentioned earlier, from an epidemiological point of view, it's important to take into account the pre-pandemic trends when evaluating the impact of the pandemic. In fact, this context helps us to understand whether the changes we observed in year 1 were truly due to COVID-19 or simply a continuation of existing trends. First, we can see that declines in STEMI, CHF, CVA, atrial fibrillation, CABG, and defibrillator insertion followed a decline in pre-pandemic trends, while the decline observed in non-STEMI went in the opposite direction to the increasing trend from 2012 to 2019, and the decline in catheterization, ablation, and pacemaker insertion occurred after a relatively stable trend during the pre-pandemic period. Second, and most important, when we compare the observed rates in year 1 to the expected rates, marked here by red dots, based on the pre-pandemic trends, we can see that most diagnoses and procedures, including STEMI, non-STEMI, atrial fibrillation, catheterizations, CABG, and pacemaker insertions, were significantly lower than expected. For CHF, stroke, and ablation, the observed rates in year 1 matched the expected values fairly closely, and defibrillator insertion was actually higher than the expected rate, even without a pandemic. The increases we saw in year 2 of the pandemic also varied when compared to the pre-pandemic trends. STEMI, catheterization, and CABG returned to their expected levels. Non-STEMI and atrial fibrillation were lower than expected. On the other end, rates of CHF, stroke, pacemaker insertion, ablation, and defibrillator insertion were higher than what we would have predicted based on the pre-pandemic trends. In summary, in this large retrospective population-based study of about 2.6 million Israeli adults, we observed significant declines in all cardiovascular diagnoses and procedures during the first year of the COVID-19 pandemic. This is compared to 2018. When we assessed these changes in the context of pre-pandemic trends, we saw different patterns. Some outcomes like CHF, stroke, and ablation remained within expected levels. Others, like STEMI, non-STEMI, atrial fibrillation, catheterization, CABG, and pacemaker insertions, were lower than expected. However, defibrillator insertion was even higher than what we would expected without the pandemic. In the second year of the pandemic, all outcomes increased compared to year 1, but not all returned to their pre-pandemic trajectories. Some returned to expected levels like STEMI, catheterization, and CABG. Others, like non-STEMI and atrial fibrillation, stayed below expectations, and several, such as CHF, stroke, pacemaker, ablation, and defibrillator procedures, rose above the expected rates. The declines observed in the first year of the pandemic can be explained by two main factors. First, many individuals avoided seeking medical care due to concerns about COVID-19 exposure. Second, many elective cardiovascular procedures such as catheterization and CABG were postponed during that time. In the second year, the increases in procedures may reflect both an accumulation of postponed procedures, mostly elective, that were postponed during year 1, and a worsening of cardiac condition due to reduced treatment in year 1. Also, the updated clinical guidelines in 2020, which expanded the indications for ablation in patients with atrial fibrillation, may have also contributed to the significant rise observed in ablation procedures. In conclusion, the COVID-19 pandemic disrupted ongoing trends in cardiovascular care with varied effects across outcomes. From an epidemiological perspective, considering long-term trends is important to understand the true impact. Possible long-term consequences should be monitored and taken into account by health policymakers. Thank you.